Welcome, friends. In this second session of International Health, we just try to remember that our slogan, Sarve Janaha Sukhinaha Bhavantu, Sarve Santu Niramayaha, has been accepted by the entire world now. And similarly, Vasudhaiva Kutumbakam, the entire world is a family. This was being discussed in centuries, but ultimately, as far as the concern of health is concerned, it could be realized when the establishment of WHO took place. We went through the history that it started before centuries with the word quarantine. The regulations of the quarantine took 1 century or 1.5 centuries to finalize. USA took the initiative by establishment of PAHO, Pan American Health Organization, and then Europe also came into the front and combined efforts led after two world wars. Somewhere after 1943, the Second World War ended, and we had establishment of WHO in 1948. Now, in this session, we are going to focus on the World Health Organization, WHO. It is the only single agency which works through the intergovernment management. Say it works through the governments, but at the same time, it's the biggest non-government organization which acts internationally. 1946 contribution, the constitution was framed, but the 7th April 1948 is remembered as World Health Day because every year we are celebrating it in the memory of the establishment and actual activity started on 7th April 1948. The span of activities was actually attainment of the health, and this means the attainment of the health by all people. This was a very big ambit where everybody can be involved. So all nations must have been the members of WHO, but it did not happen immediately. Gradually that increased. Now current objective is the attainment by all people, that is people of the world, a level of health that can permit them to lead a socio-economically productive life. Now, say definition makes it more accurate. What do we mean by health? Health defined in different ways, physical, social, psychological, or these domains. But if the person is living socio-economically productive life, this is a point which can be checked by everybody. It can be quantified. And that's why WHO's current goal is related to the socio-economic productive life by each and every individual. The Constitution has defined health, which you have studied in the initial lectures. Health right has been discussed. That's also part of our curriculum. You have gone through that. Achievement anywhere is achievement to all. Say, this is very important. WHO believes that even if a small country has healthy atmosphere, that is contributing to the health of the entire world. Nobody is an exception. But at the same time, if somebody is sick somewhere, even in a small country or a big country, this can be a big challenge to the entire world. So one and all, this philosophy is really useful philosophy for controlling the disease and promoting the health. Then one more is unequal development is danger. See, whenever the development is lagging behind, a country is poor, is suffering with different communicable diseases, it is quite possible that the same diseases may be transferred to other diseases, and such transmission will be dangerous for the entire world. WHO works on this. One more point is governments are responsible. It's not that governments are only to govern bigger things like say land reforms and other things. They have to look for the health also. Health is the development, sometimes it is said so. WHO is the only United Nations body which is working for the international level with the governments. This may be remembered, please. In 1978, a scope was there for Alma Ata declared the primary health care mission. WHO is working since then with the collaboration with the UNICEF UNICEF is another international agency. We will be talking about that in brief. Global Strategy for Health for All, that was decided into 2000 at the end of last century. And health for all is again the principle which has been cherished by WHO since beginning. Last but not the least is Millennium Development Goals. WHO finalized several goals which can lead to overall development of individual, of nation, and of the world. So Millennium Development Goals is one more sphere in which WHO is working intensively. We would like to just brief about what is the structure of WHO. All the members who happen to be the members of WHO, they need to contribute funds every year according to their capacities as per decided by their governance. But at the same time, they are eligible to take all the advices, all guidance, all the developmental issues with WHO. WHO contributes in form of the knowledge and assistance, while they are contributing in terms of the funds. So membership is open to all. Initially there were 56 members, and now, as on say 2010, there are 194 members in WHO. Needless to say that we are also members of the WHO. Membership is there is another membership, associate membership. There are countries or the areas where they themselves are not responsible for the implementation of the health issues, and that's why they may be taken up as associate members. The only difference is associate members cannot vote whenever there is the election for different posts in the WHO. Work of the WHO, we have already briefed it in the last session, but going into little details. First and foremost work was prevention and control of the diseases. We must remember the landmarks. Eradication of smallpox was possible because of the international support and cooperation. Eradication polio has also been almost achieved. Epidemiological surveillance is going on, and COVID-19 is one of the examples where WHO is assisting all countries simultaneously. WHO has established the novice systems like say automatic telex reply services, where the information is sent very easily and immediately. There is weekly epidemiological record or report being given by WHO to all countries, all member countries, and one can share with them. WHO emergency scheme for epidemics is also useful to many of us. International health regulations have been now codified, have been published by WHO for various conditions. So, in nutshell, WHO has taken up a large area of health promotion, disease prevention, rehabilitation, apart from the first word of quarantine which we are talking about. Now the new issues which are being coming up are the non-communicable diseases. So far we had been concentrating on communicable diseases, and see unlucky we are that we have to focus on communicable diseases so far with the COVID-19 example. But at the same time, non-communicable diseases are being rampant, and we need to focus on that. When we are focusing on the communicable diseases, naturally not only disease, but even vector biology, their control, immunology, quality of drugs, quality of the biological products, quality of laboratory techniques will come up. And WHO is definitely looking up. When we talk about immunization or immunity, expanded program of immunity is something which has been launched by WHO, and that has benefited millions of children all over the world. So that was about prevention and control of the diseases. But that's not all. The second major activity is development of comprehensive health service. For carrying out all this, we need to have a structure, infrastructure, manpower for the activities. And therefore WHO provides guidance to frame the national health policies. And each nation can frame their own programs. Health system and primary health care is one of the examples. Health management or health manpower has to be generated more and more, because we will look after that. So manpower management, utilization of manpower, infrastructure again, health service research. This is new. What is beneficial in health service? What is redundant? What should be improved upon? That is an ongoing exercise. One more thing which needs to be noted is appropriate technology for health, or ATH. What is that? If a country is very poor, the instruments generated are such which can be locally made, locally utilized, and locally accepted by the people. Say, it's very important that the people accept that instrument. Otherwise, it will be of no use. Other areas of family health, where the maternal and child health is being taken care of, quality of family health is also improved. Environmental health, protection of quality of water, air, and food is also being taken up by WHO. Conditions of workplace, occupational health. Say almost all chapters in preventive and social medicine will be covered when we talk about the functions of WHO. So occupational health is also looked after. Environmental health criteria have been fixed. So what is good for the environment, what is not good for the environment, what are the levels which are permissible, these are decided by WHO. And they are being monitored by them. So there are monitoring programs also for that. Health statistics is very important. Based on the statistical analysis, we can start implementing different activities. Morbidity, mortality, you know that in the vital statistics we study that. So weekly epidemiological reports are available from WHO. So the country can take action on that issue. Similarly, such reports are available quarterly and annual reports are also available. One more thing is international classification of diseases. When we say disease, what is that disease? There has to be definition that a particular disease must be having these criteria. So there is international classification of disease so that the statistics become easier. Unless you classify, there will be only data, figures, but figures have to be in different classes which are well defined. So international classification of disease ICD-10 is being worked out, has been worked out by the WHO. Biomedical research, a new field, where continuously we will have to find out the ways to fight with the disease. The WHO itself does not carry out the research, but it stimulates and promotes the research and research organizations. There are WHO collaborating centers which do these activities. In each region of WHO, there is a collaborating center. There is global and regional advisory committee for such biomedical research. Especially, they are focusing on the countries where the poverty is rampant. These are tropical countries. And in these countries, 6 deadly diseases are present, like malaria, schistosomiasis, trypanosomiasis, filariasis, leishmaniasis, and leprosy. These 6 tropical diseases are being fought against by WHO. They are specifically targeted. Health literature and information. Everything is being done and said, but that has to be disseminated to everybody. And WHO Library is one of the satellite centers of Medlar. You know Medlar. And all informations are now digitally available all over the globe. And this is connected with the public information service. So even a lay person, if he knows computer or if he knows how to use the information, he can get information on each and every point of WHO. I suggest that you go to the WHO site www.who.int and you will find a lot of literature on that. Please go through that. And all these activities are done with the cooperation and collaboration with the other UN agencies. The United Nations have several agencies working in different dimensions. For an example, UNICEF. So WHO works with that, and that is also one of the major functions. After all, what is WHO? WHO's core committee is World Health Assembly, WHA. Now, it is the supreme governing body in WHO. It is being represented by delegates of all member countries. And it is an international health policy decision maker. Annually, it meets at Geneva. Geneva is the headquarters of WHO. It reviews the works of the past years and makes a path for the future. The budget is being approved, and some specific technical subjects are also being discussed in the WHA. Executive board is being elected from the World Health Assembly. From World Health Assembly, elected executive board will have all the decisions to be carried out. they actually implement it. There were originally 18 members, but now there are about 34 members in executive boards elected from the World Health Assembly. Every year, one third of the members of the executive board are changed so that there is continuity of the information. These members must be technically qualified. You see, this is very important. Executive board members must be technically qualified in the field of health. That leads to real good decisions for the health promotion and prevention of the diseases. It meets twice a year and works for giving effects to the decisions taken by WHO. But in emergency, executive committee or executive board can take its own decisions, like say epidemics or earthquake, then they can decide of their own. Minimum members from each region, WHO has regions in the world divided into that. And these regions must be out of 6 regions, each region must be represented by minimum 3 persons in the executive board. So, World Health Assembly is a representative body which forms the policies. Executive board executes it, and then comes the WHO Secretariat. When I want to execute something, I need persons to execute it. These are the WHO Secretariat. And in Secretariat, about 8,000 experts, 8,000 plus experts are working. There are several other members, other persons who are support staff. They are beyond that. This is headed by Director General. Director General is selected by the Executive Board. And that's why the entire machinery, World Health Assembly, and then Executive Board, then WHO Secretariat, they make this. There are more than 14 divisions in the Secretariat. And you can immediately recall them because your chapters in PSM also talk about that. For an example, Division of Epidemiological Surveillance, Division of Communicable Diseases, Division of Vector Biology, Division of Environmental Health, Division of Public Information and Education, Division of Mental Health, Division of Diagnosis, Treatment, Rehabilitation Technology, Division of Health Service Strengthening, Division of Family Health, Division of Non-Communicable Diseases, Division of Health Manpower Development, Division of Information System Support, Division of Personnel and General Services, and Division of Budget and Finance. These are the divisions which are essential for any public health larger institute. WHO works through several regions. There are 6 regions: Southeast Asia, Africa, Americas, Europe, Eastern Mediterranean, and Western Pacific. We are in Southeast Asia region. Southeast Asia region has the headquarters in New Delhi. Which are the countries in Southeast Asia? Nepal, Bhutan, Bharat or India, Myanmar, Bangladesh, Indonesia, Maldives, Sri Lanka, Democratic People's Republic Korea, Thailand, Timor-Leste. All these are talking about the South and Southeast Asia. India is the main country, our biggest country in all these, and that's why the headquarters is in New Delhi. Africa has its headquarters in Brazzaville, Congo. America has its headquarters in Washington, D.C. Europe headquarters in Copenhagen, Denmark. Eastern Mediterranean, Alexandria, Egypt. Western Pacific has headquarters in Manila, Philippines. So WHO has regional director in each regional office, which works with the technical assistants and technical administrative officers. There are members of secretariat, and each country of that region is represented in the WHO regional office. There are regional committees for different issues. Now, when we are talking about WHO in details, kindly go through in the textbook. Also visit the site for the WHO, who.int. Other organizations that work for the international health include UNICEF. The full form is United Nations International Children's Fund Emergency Fund. It was established in emergency, but now it is working for the children only. Now, because after the World Wars, there was need for the emergency fund. But after 5 or 6 years, everything was complete and it was handed over for the welfare of the children and mothers, especially. Another agency is the UNDP, United Nations Development Program. Another one is UN Fund for the Population, FAO or Food and Agriculture Organization, International Labour Organization. All these organizations work with each other because health cannot be taking place in absence of the agriculture, in absence of the other services like say water, sanitation, etc. There is ILO, International Labour Organization, which is also working because labor force is also to be looked into for the occupational health, and World Bank is funding most of these projects. That's why they are also very important. Few lines on UNICEF will help because UNICEF has its headquarters with the UN, which is in the Washington DC, and initially it was for the rehabilitation of the war affected children, but 1953 this was diverted for the issues related to the children. Total development of the children is the goal of UNICEF. I need to add here that health is related to agriculture, milk production, etc. Total development of a child includes education. That's why UNICEF is contributing to many things, like say vaccine generations. It also provides assistance to the India for BCG vaccine, penicillin plant, DDT plant, because it will curb the malaria and ultimately it will make good for the children's health. And DPT vaccine plant, iodized salt plant. It also supports dairy plants. It supports vitamin A supplementation. It supports iodized salt plants. It supports IFA tablets, iron and folic acid tablet distribution. All these issues are being looked after by UNICEF. So one word which is all often asked for UNICEF is the latest development of GOBI, GOBI. UNICEF has focused its activities on growth chart, G, growth chart of a child, which talks about the health attained by the child or the deficiencies of the child. O for oral rehydration, the key instrument to fight the diarrhea. B for breastfeeding, again a key instrument for protecting the child, particularly newborn child. I for immunization, all immunization should be given to the child. With this small note, we end up this lecture. Kindly go through in the details about other organizations which are working for the international health. Also have a look at the ICD-10, International Classification of Disease, and that's why this will be a beginning of the study for the international health. It's a very vast subject, but briefing about that, summarizing about that will definitely include the institutions like WHO and UNICEF. We meet again after some time to discuss the different issues related to UNICEF and WHO. Thank you.